Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Please subscribe our channel if you have not. Our contact number is 7696734256 for the best OET coaching. And I always say, please listen to our videos till the end, because there are certain points which are always covered at the end of the videos. So please try to do that. And again, this is Dr. Bhupesh, having an experience of more than 10 years teaching OET. So today we'll take you to a class which again, my current batch of OET has asked. So I'm just going to record it for every one of you guys who are my current candidates for OET, and you are having exam day after tomorrow. So wish you all the luck who all are having exam, and I will try to cover each and everything today regarding the writing. It would be little interesting. So please keep your patience high, as well as I will try to keep it very, very interesting for you. Yeah. So first of all, the letter that I'm expecting this time, because in the last two times, this letter has not come, which normally I say discharge back and referred back letter. I was expecting it last time as well, but it did not come. I was expecting it last to last time. It did not come. So again, we never can say anything about OET. So that is the first thing I want to say. Nobody knows what's going to come, what is right, what's wrong. So please do not take this as the final video that, okay, this exam is going to come. So please try to listen to this video till end. I will cover each and every type of letters. First of all, discharge back letter and the referred back letter. This is the most common letter that can come. So I have, tried to take this letter from original OET site. This is again, this letter I always want you to do every time. Matlab, if you are taking exam, whether discharge back letter is expected or not expected, referred back letter is expected or not expected, this is a short letter that should be done every time. So what is special in this letter, if you will realize, see the data. So when you see the data, and if such a big letter comes in your exam, if you will write all the words, it would be more than 200. And in OET exam, we are allowed to write only 200 words. Again, there are certain confusions. Sometimes in OET paper, it is given 20, don't write more than 25 lines. So don't worry about this. Don't write more than 25 lines. Please don't worry about it, because this does not mean 25 lines ऐसे वाली कि one line, two line, three line, four line. This is not four lines in OET. So please don't consider that. Sometimes people start counting 1, 2, 3, 4. ऐसा नहीं करना. Don't do that. So don't write more than 25 lines. It would be written in exam, but don't worry about it. If you will use the right connectors, anyhow you will not write more than 25 lines. 25 line means this letter is being written regarding Mr. Matthews, who has been assessed with this problem, for which required treatment has been given. So this is not three lines. This is one line where the first full stop comes. So what they want to say you by 25 lines is that you should use connectors. If you do not use connector, then this line would be over. So this is one line. Then you start the second line. You do not use the connector. This is two line. So that is where OET wants to tell you to use connectors so that it can become one line. And then counting this line as one line now, rather than three lines, it is just one line. Why? Because you have used connectors. So that is what OET says, that you don't write more than 25 lines, means use connectors. So don't worry about it. If your English is normal and is good, if you have taken coaching from Dr. BKM or you are listening to our videos, anyhow, this word count will be in control. Today, I will try to talk in English because I know there are a lot of people who are my audience, but they listen to Hindi. But please try to listen this video 2-3 times. It will improve your listening. It will also improve your speaking. So please listen to this video. So yeah, in this letter, what is happening? The data is too much. So first of all, I have told you about data control. Second thing, I have told you about the sentences when it is given in the exam. Now the third point, the most important thing, any of the letter, whether it is a big letter or a small letter, always read it from the end. So I'm reading it from the end. You are the community nurse and you are writing letter to Suzanne Matthews GP. So this is the main thing, you are writing to the Suzanne Matthews GP. So that is where you can understand patient's name is Suzanne Matthews. If you will go on the first page, you will find the patient name as Suzanne Matthews. So you are writing to the patient's GP. What does it mean? That the GP belongs to patient. Patient is already a patient of GP. That means there is no use of social history, there is no use of medical history. These are the two things that you don't have to include. So automatically your word count will come in control. Now, the first paragraph is always about purpose. So the purpose is follow-up care. And you are concerned about the patient's mental health, weight, and wound. Always consider these points: health, weight, and wound. These are the three main points. And we want follow-up care. So that is why we are writing letter to the patient's GP and telling the GP to provide the follow-up care. Normally, GP means physician, means MBBS doctor of India. The people who are having general clinics. So in foreign countries, these are known as GP. GP means general practitioners. They have a clinic. So even if you have a very big problem, first of all, you will go to GP and then you will be referred to senior doctor, ophthalmologist, gynecologist. So this is later on. So this is what you need to understand. So talking about this particular thing, requesting follow-up care. Patient coping reasonably well, very positive. So one of the point is mental health. So you are saying patient is very well now and is more positive. Second point, you are worried about wound. So wound is good, there is no sign of infection. That means patient is better now. So we are telling the GP that patient is better now, mentally positive. Wound, no infection. Weight, eating well, needs to be monitored. So that means now patient is very well. You just need to provide the follow-up care. That is what we want to say to the GP. What has happened with this patient? Now I would like to go on the first page and only the last date I read. Last date, because that tells about the current condition of the patient. Last date, that tells about the current condition of the patient. And to whom you are writing the letter is Suzanne Matthews GP. So these two important things I have found. So what happened to patient? She is 76-year-old, husband died, so she is alone. What happened is presented to our emergency department on 10th due to accident. And she was having laceration. 10 sutures were applied. So on 10th, sutures were applied and today the date is 20th. So after 10 days, sutures are still there and they will be removed after a week. Patient is now well, mobilizing independently. So that is the current condition. And what happened to patient? She fell. Suzanne Matthews fell, had an accident. She was cleaning the fan. Now, if I have to write the first paragraph, it is that simple. This letter is being written. Please try and understand. This is highly expected, but this is one of the most difficult letters. And if you will learn this letter, then you will feel much ease. This is the most difficult letter. This letter is being written regarding Mrs. Matthews. Always write second name, only the second name. Mrs. Matthews, or you can say regarding one of your known patients. Because this is the main punch of the letter. Please understand, patients. S bhi likhna hai. You have to write S as well. So I'm writing this letter regarding one of your old patients. So this is the most difficult letter again, I'm telling you. And listen to the end because I will explain you different types of letters in the end. And subscribe the channel if you have not, please. This letter is being written regarding one of your known patients, Mrs. Matthews, who was admitted on 10th. So whatever March, April, I don't know what is given. So I'm just going to trace it as well. 10th November. So who was admitted on 10th November 2016 due to laceration. Main point only. On right thigh. On right thigh? Yeah, on right thigh. So only right main point. on right side. So treatment was given, which included, if you can write that smartly, which included application of 10 sutures. That is how I will write if I will have my exam. But if you don't want to make it complicated, treatment was given, which included 10 sutures. Simple. I wrote application of 10 sutures because sutures were applied. Applied means application of 10 sutures. And as a result, these are the connectors you need to learn. Best connectors. And as a result, she has started mobilizing independently. So that is what we want to say. She has started mobilizing independently. Every time I write this letter, I write it always in different ways. So as a result, she has started mobilizing. Now she needs follow-up care, and being her GP, you are requested to provide her follow-up care. GP से request करना है. You are requested to provide her follow-up care. Make it very simple, very nice, very effective. Also, there are certain things that you can add in this letter. Abhi, this is the simplest letter. मतलब अब तो this is very simple. But when you will go to the letter, you will realize what happened. That patient was admitted to the emergency hospital. Then she was not interested in the food. Also, she was disoriented. Matlab mentally, she was disoriented. She didn't know how the accident happened. She was not interested in the food. Wound dressing was done. Mental health was monitored because she could not remember what happened. So that is why mental health was monitored. 10th, 11th, 12th, third day. Again, there was a temperature, so she got infection. 13th, dietitian review, high protein diet was encouraged. Physiotherapy was given to mobilize the patient for showering, toileting with transfers. So treatment, wound and clean dressed. On 14th, after 4 days, patient's condition started improving. Following diet, enjoying food. So earlier she was not interested in food. Now she's following diet, enjoying food. Swelling reduced, no exudate. That means fever gone, infection subsided. Medication, paracetamol वगैरह was given. Then she was referred to community nurse. Who is community nurse? That is why this letter is complicated. Who is community nurse? You are the community nurse. So that is where this letter becomes complicated. So that means this emergency department was not your emergency department. So that is why you change the letter. Who was admitted to an emergency department, because that does not belong to us. So who was admitted to an emergency department. On this, treatment was given, which appeared, and as a result, ठीक है, 10 sutures included application. So आप ये कहोगे later या after 5 days, whatever you want to say. After 5 days, she was transferred to our community. She was referred to our community center. And हमने क्या किया community center में? Let's see what we have done in the community. Patient was moody, lonely, so mentally patient was not active. Diet regime was given. She was following it in the hospital, but when she was discharged from the hospital and was referred to us, she was not coping with it. Mobilizing well, but with the frame, so she was not mobilizing independently. So she was having mental problem, lonely, and this. She was having diet problems. She was unable to cope up. She was not mobilizing. So these are the 3 points they have given: mental health, wound, and weight. Wound was cleaned and dressed with antiseptic solution, and then wound became better. So with our 4 days of services, her mood has improved. She has started meals on wheels, means khana khana shuru kar diya. Pain is controlled, no infection. Today patient is coping well, positive. So that is the condition of the patient. Now this is OET, where you need to make it smart. Now it is getting complicated. So what you can do, you can make this letter simple. So I'm just going to make it very simple for you. One of your name who needs follow-up care. Being her GP, you are requested to provide her the required care. दो बार follow-up care अच्छा नहीं लग रहा? The required care. Now you have made it very simple. This is the easiest way of writing the toughest of the letter, because you are mentioning the purpose, follow-up care, and being a GP, you are requested to provide the follow-up care. Now this is the best way of writing. Rest, Mrs. Matthews, second paragraph, was admitted to an emergency department on 10 due to laceration in the right thigh. Treatment was given, which included application of 10 sutures. She got infection. If you want to write, so you can, now you can pick up the data. अब आपको ये सब mix करना है. You have to mix everything. You have to mix everything. So laceration, right thigh, 10 sutures were applied. This you have mentioned. Admitted to hospital for observation. Then patient was disoriented. Okay. So 10 sutures were applied. Now make it very simple. Don't write dates during hospitalization, because you have mentioned date 10th November. So that is the only thing examiner wants to know, when patient was admitted. So today's date you all know is 20th. We have seen in the last. Today's date 21st November. I will show you again. Please keep your calm and patience. It's a very simple letter. I'm going to tell you the simplest way. Please maintain your patience. And I know it is difficult too, but keep the concentration high. You will learn a lot of things from this letter, I promise. This is going to change your life forever. So Suzanne Matthews GP. So I have mentioned one of your known patients, Mrs. Matthews. Purpose, who needs follow-up care, who needs follow-up care. Being her GP. So this is the main point. Second punch. First punch, referred back, oh sorry, discharge, known GP, one of your known patients. Second punch, being her GP. Then kahani. If you will not throw the kahani over here, so today is 20th. That is what I'm saying, 20th. And she was admitted on 10th. So now make it simple. Mrs. Math, now tell the whole story. Purpose clear. Purpose easy, done. Now tell the story. Was admitted to an emergency department due to laceration. Treatment was given, which included during hospitalization. She was disoriented. Now the main points. Main points. Which points? Main points. Ye wale. Main points. Mental health, weight, and wound. So I want to know main points. Mental health, weight, and wound. So what is happening to her mental health? Mental health says disoriented. And when she was discharged from the hospital, she was, patient's condition is improving, enjoying food, mobilizing independently, but so nothing about mental health. I hope here nothing about mental health, but she came to us in a moody, lonely state. So I'm just trying to cover during hospitalization, she was disoriented. So main point, during hospitalization, she was disoriented. So I'm just taking the main points. She was disoriented, not sure how accident happened. So so mental health was monitored. So mental health was monitored. 1 point covered. Second point, food. Further is a nice word. Rather than also, use this one. Wherever you want to use for also, use further. Further, she was not interested in food. So dietitian review was conducted. There was a line now. So dietitian review was conducted. And she was recommended high protein diet. So these are the connectors. And dietitian mention the problem, then mention the problem. She was disoriented, then use so mental health was monitored. She was not interested in the food, so ki jagah if you want to replace hence or thus. Dietitian review was conducted and she was recommended high protein diet. जिसको उसने फॉलो किया, ये कनेक्टर्स हैं. इफ यू कैन यूज दिस विच शी फॉलोड नाइसली. ये कहां से पता लगा? दिस केम फ्रॉम हेयर, दैट फूड शी वाज फॉलोइंग. Yeah, following diet, enjoying food nicely means enjoying food nicely. So I'm writing in very simple way. Third point was my weight. Wound. So weight eating में आ गया, disoriented mental health में आ गई. अब now the point is wound. She got infection in the wound. For which another connector. Please learn the connector. If you will listen to this video 5 times, you will learn the connectors as well, commas as well. So at least 3 times, please. Matlab, this will make you the best person of writing, and you will understand how simple we can write. She got infection in the wound, for which antibiotics were started, या were prescribed. So अब antibiotic रोक दिए, antibiotic course is over. Nothing says about antibiotic. It's just the paracetamol they are saying. Oral penicillin for 7 days must complete. So she was given oral penicillin. So antibiotics were prescribed for 7 days. Or you can write the name of the medication as well. But why name is not important? Because now for the GP, he does not have to give the medication, because the medication was started on the discharge. It was sent 7 days. So the medication was started, antibiotic was started on 12th, because 12th, then 7, 12 plus 7, 19. So now we don't have to tell the GP about the medications, because 7 days course is over from 12 to 19. So this is how smart you can be. Choti choti cheezein. This paragraph over. Her infection subsided. Whenever there is any symptom, her infection subsided, and she was referred to us. Now in this paragraph, if you want to make anything short, you can, but I had to include everything sutures, because I have to tell the doctor that sutures will be removed after a week. So that is why I mentioned about the sutures. Mental health, I had to tell, that is why I mentioned this point. Not interested in the food, because now follow up care में weight has to be monitored, तो food का भी हमें बताना पड़ेगा, और यहाँ पे भी दे रखा है eating well but needs to be monitored. So this was also important point. She got infection, antibiotics were there, infection subsided, and she was referred to us. This I consider can be something that you can write or you cannot write. But wound की आप condition बता दो when she was referred to you. Wound was, there was no exudate and swelling reduced. So that you can say, otherwise you can say that and she was referred to us. But wound की बात करनी पड़ेगी, because that is the primary thing. So her wound got infected. वही वाली line को वापस लिख देते हैं. Sorry. Her wound got infected. So that is why I'm saying don't mention everything. If you will mention about antibiotics, her wound got infected, but later on infection subsided. छोटा कर दिया मैंने. Infection subsided with antibiotics, and she was referred to us. छोटा कर दिया. She was referred to us, passive voice, was were third form, referred to us with nil exudate and fever. No exudate and fever. Infection हुई थी तो exudate और fever तो आएगा ही, तो अब नहीं थे जब हमारे पास भेजा. Now the story is complete of the hospitalization. Second paragraph is all good. Now story of ours. On 16th, she was referred to us. Simple. Matlab, I'm making it the simplest I can. Don't mention too many dates. You will get confused. Your examiner will get confused. Please make it the simplest letter of the world. Even this difficult letter can be made that simple by noticing the points. So the letter is all judged from here and here. These are the 2 points. Purpose of the letter decides the whole letter. So on 18th November 2016, she was referred to us for community services. ये लिखी दिया, she was referred to us. So she was having, now she was moody and lonely, sorry, and not coping up with the new diet regime. Same line दिखाऊंगा. She was moody, lonely, and was not coping with new diet regime. You will notice that I have exactly written the same words. Refer to meals on wheels. Diet की बात करते ही therefore she was referred to meals on wheels. On wheels. And if you will notice the current condition of meals and wheels, eating well. Meeting, so she was referred to meals on wheels, and now current condition is she is eating well. But eating well. चलो इतना ही लिख देते हैं. She is eating well. Regarding the wound, wound कहाँ पे था? Wound was cleaned, so it's all good. Wound का कोई इतना बड़ा प्रॉब्लम नहीं है, तो wound के लिए बस ये लिख देंगे sutures will be removed within a week. ये बाद में लिख देंगे. Wound, her wound is good. There is no sign of infection. And positive. पॉजिटिव कैसे हुआ? काउंसलिंग दिया हमने. पेशेंट मूड गोट इम्प्रूव्ड. हाउ? नथिंग इज गिवन. अ सोशल वर्कर लोकल सपोर्ट. सो अब यहाँ पे अगर टूट गया, या तो आप इसको अलग ही लिख दो. शी वॉज नॉट कॉपिंग विद डाइट, इसको पहले लिख दो. देयरफॉर शी वॉज रेफर टू डाइट और मील्स. हर मूड, उसको अलग लिख दो. हर मूड वॉज लो and she was moody and isolated. Now simple points: she was moody and isolated, so she was referred to locus group. अब यहाँ पे आप कनेक्टर चेंज कर सकते हो. फॉर विच, देयरफॉर इसमें बार बार यूज हो रहे हैं, तो आप ऐसे भी यूज करते हो. नहीं तो आप ऐसा भी लिख सकते हो, एंड लगा के फॉर दैट. अगर फॉर विच भी रिपीट हो रहा है, देन यू कैन यूज फॉर दैट. एंड फॉर दैट शी वाज रेफर्ड टू. बिल्कुल अजीब नहीं लगेगा. एंड फॉर दैट शी वाज रेफर्ड टू local support groups. So we have given her all. Her wound. So dressing was done and wound was cleaned. So what I have done, I have majorly taken the treatment we have given in the support group. She was referred to meals and group. Now I will talk about today. Today her mood is better. Now simple, her mood is better. Why it is better? Because we gave her counseling. Her mood is better and she is enjoying food. अगर ये वाली लाइन वहां पे नहीं लिखनी, यहाँ से हटा सकते हैं. इफ यू डोंट वांट. सो शी वाज रेफर्ड टू मील्स ऑन व्हील्स, और ये पॉइंट छोटा हो सकता है, बट दैट्स ओके. सो हर एंड शी इज ईटिंग वेल. सो आई एम जस्ट टेलिंग द करंट कंडीशन इन द लास्ट पैराग्राफ नाउ. बट इट नीड्स टू बी मॉनिटर्ड. कि वो खाना खा तो रही है, बट सर इसका ध्यान रखना, इसके वेट की प्रॉब्लम है. बट नीड्स टू बी मॉनिटर्ड. मूड इज बेटर. मेंटल हेल्थ आ गई है. मेंटल हेल्थ के लिए कुछ करना है. Is there any point for the reasonably more positive? So her mood is better, she is more positive. ये बातें अगर आप ज्यादा लिखना चाहते हो तो भी लिख सकते हो. अगर पूरा लिखना चाहते हो कि she is coping well and more positive, so she is coping well and is more positive. Don't, she is coping well and is more positive. बस जो दिया वही लिख दो. Don't worry, दोनों चीजें ठीक है. Don't worry again, don't make OET complicated. You just need to tell GP कि क्या हो रहा है आपके पास, आपके पेशेंट के साथ. She is eating well now, but needs to be monitored. But या फिर लिख सकते हो but needs monitoring. Simple, ये भी done. She is mobilizing independently. She is mobilizing independently. And her sutures should be removed. Passive voice should be removed within a week. Khatam. That's it. All over. And total, it's such a good ladder to revise and to listen to the video. And your letter is over now. Everything is done. If there is any point missing, she's mobilizing in or wound good. Wound is good. There is no sign of infection. Her sutures will be. She's mobilizing independently, and her wound is good. So wound good है, so suture should be removed, या फिर इसको अलग से लिख दो, please note. So you just keep on improving your letter. And that's pretty much it. This is your letter. Total, I know it's very hard to listen to, but total I have taken 29 minutes or 28 minutes. And this complicated letter is in front of you. Now read the letter. This letter is being written regarding one of your non-patient, Miss Matthew, who needs follow-up care. Being her GP, you are requested to provide her the required care. Mrs. Matthew was admitted on 12th. Treatment was given, including the application during hospitalization. She was orientated. ये थोड़ा सा अजीब लग रहा है. So treatment was given. So during hospitalization, we should change it here. During hospitalization, let's change the word here. During hospitalization, 10 sutures were applied. Make it simple. And required treatment was given. So this is easy for you. Now don't write during hospital. So during hospitalization, she was discharged, so mental health was monitored. Further, she was not interested in food, thus dietitian review was conducted, and she was recommended. She was recommended means patient was recommended a high protein diet, which she followed nicely. Her wound got infected. Her wound got infected. Goat word got missing. So do mention this word. That is why I'm saying when you will listen to again to this letter, you will find this word goat. You will learn this word. But later on, infection subsided. With this, you will learn infection subsided. No need of was. It's an active form. Infection subsided. And she was referred to us with nil exudate and fever. So that was the condition. On 16, she was not coping well. तो यहाँ पे ये गड़बड़ लग रही है. On she was referred to us on 16th November. Now I will remove this word and it will become even nice letter. Initially, she was not coping with the new diet regime. Therefore, she was referred to meal zone. She was moody and isolated, and for that, she was referred to local spot. Dressing was done, wound was cleaned. Today, she is coping well and is very positive. She is eating well now, but needs to be monitored. She is mobilizing and her wound is good. Please note, sutures should be removed within a week. Done. That's your letter. And please, I'm keeping this letter in front of you for 2 minutes. Please read this letter and try to listen to this video 3-4 times. It will make your life. Rest of the letters, obviously. Now talking about rest of the letters. Suppose it's a discharge letter. So in discharge letter, what will happen? This letter is being written regarding Mrs. Matthews, who needs follow-up care after discharge. Therefore, she is being referred to. Same. इसमें so discharge letter में क्या होता है? बस ये नहीं लिखते. One of your patients being her GP. इसको उड़ा दो. This is discharge letter. And visit letter. This letter, only 3 kinds of letter. This letter is being written. Today की problem बताओ बस regarding Mrs. Y who is having, जो भी आज की प्रॉब्लम है. अगर सस्पेक्टेड है तो who is suspected with, जो भी आज की प्रॉब्लम है. Therefore she is being referred under your expertise. That's it. खत्म. बाकी सब तो बीच वाले पैराग्राफ्स तो वैसे ही आसान होते हैं. She is being referred to you. बीच वाले पैराग्राफ्स में in the middle paragraphs always remember that you should include only the data which is relevant to the today or the last paragraph. So even in these letters, इसी last paragraph पे पूरा का पूरा letter खड़ा होता है. In the last paragraph decides what all would be included in the letter. And how do we see it? In the last paragraph, here and here, it is given the purpose of the letter. And almost if you will realize, first and the last paragraph are almost same. In the first paragraph, you say in brief follow-up care. And in the last paragraph, you explain the follow-up care that sutures will be removed, needs to be monitored. She is more positive, but needs to be monitored. So if you will say mental health needs to be monitored. So if you want to write it here, there is nothing. She is coping well and is positive, but needs ongoing, but needs continuous monitoring. You can write because obviously that is why we are telling the GP, but needs observation. So बार बार monitoring क्यों लिखें? Observation word लिख देते हैं. That's it. That's your OET. मतलब No matter how difficult the exam will come, प्लीज इस लेटर को 4-5 बार लिख लो. लिख लो, कोई बात नहीं, 4-5 बार सुन लो, 2-3 बार लिख लो. You will not have any problem in OET writing. This is Dr. Bhupesh from Dr. BKM Institute. Our contact number is 76967 34256. Subscribe the channel. Thank you.